Thank you so much, colleagues and dear friends, for inviting me to make these video submissions. I am a medical doctor by training and, of course, have had various interactions and different interventions on this very important issue of intersex and human rights. Intersex people are born with sex characteristics that do not fit medical norms or expectations of the binary female or male bodies. And there are multiple and diverse manifestations within the intersex umbrella and more than 40 relevant genetic traits that we know of. Intersex is as normal as any other variation, and these traits are innate, so they can be identified at any age, at birth, or at early childhood, during puberty, or even later in life. We do know, however, that intersex persons risk many human rights violations and abuses due to their physical traits. And these include, of course, forced or coerced medical interventions, harmful practices, societal practices, and other forms of stigmatization and social exclusion. I want to share with you my personal experience as a medical student and now a doctor of what I have witnessed and how these experiences have been important for me to understand, but also undertake my mandate as a special rapporteur on the right to health. I witnessed newborn babies already being exposed to questioning and doubt within the first minutes of their birth. The steps that followed sometimes included observations by medical staff without telling the parents that they have particular concerns, or sometimes talking in a way that made parents feel very worried and overwhelmed about the so-called abnormality based on what the medical staff were assessing as external examination of genitalia and what they deemed normal or not normal within a very heteronormative binary. Much of the conversations were more on causing concern and not informative, or even less about the well-being of the child regarding their physiology or mental or emotional well-being of the parents. And without a care for stigma, which was often already internalized, but also very present in the medical community and society in general. The timing of these conversations about some of the interventions, which were often surgical, was also very telling, in that there were more of a consideration for cosmetic rather than physiological support or need. And I, as well as my predecessors in the mandate of the right to health, continue to advocate for respectful care, for antenatal classes that must include information on intersex health, and that doctors and other healthcare professionals should have a curriculum training and updates from what we have been taught as doctors, which basically did not have human rights, but also ensure that human doctors and, of course, healthcare professionals are taught the range of normal genitalia through an understanding and teaching that incorporates what intersex persons go through. We know many people have traumatic experiences that continue to impact their physical and mental health, and that many cannot engage with the health or medical system that caused them this harm in the very first place. And often, the medical system underplays this harm or completely denies that it has caused the harm. And so the onus is on all of us who are professions, who are legal scholars, who are research academics, but also you, member states, to ensure that we make better decisions, we better equipped healthcare workers, but we ensure that we center the health and human rights of intersex persons. In addition to forced and coerced medical interventions, as well as stigma and discrimination, intersex children, as well as adults, are subject to human rights violations, including violence, infanticide, discrimination in the education system, in the healthcare, employment, in sports, in access into other services, and to their own medical records. They face obstacles in legal recognition of their gender identity. In addition to forced and coercive medical interventions and stigma, intersex children, as well as intersex adults, are subjected throughout their life course to human rights violations, including violence, infanticide, and discrimination in education, healthcare, employment, sports, as well as in accessing services and their medical records, for example. At the 45th Human Rights Council session, a cross-regional group of 37 states delivered a joint statement calling on states to protect the human rights of intersex persons. This was a very important step, and following up on the similar joint statement was delivered at the 48th Human Rights Council session on behalf of 53 states. And that statement in particular affirmed that there is a need to take measures to protect the autonomy of intersex children and adults and their rights to health and to physical and mental integrity so that they live free from violence and harmful practices. And I want to add that they also live dignified lives. Medically unnecessary surgeries, hormonal treatments, and other invasive or irreversible non-vital medical procedures without their free, prior, or full and informed consent are harmful to the enjoyment of the right of human rights of intersex persons. And indeed, in most countries around the world, intersex infants, children, adolescents continue to be subjected to medically unnecessary surgeries and hormonal treatment and other procedures as well. And it is important to understand that intersex rights are human rights and that we cannot impose societal expectations of female or male in a very binary manner on intersex children. The impact of these practices and their framing as human rights are very, very important. And they have been highlighted by several human rights mechanisms, such as the UN Office of the High Commissioner, UN Special Rapporteurs, and ourselves on the right to health, as well as many other representatives of the UN, including the Secretary General on Violence Against Children. Human rights, of course, are a language of obligation, and human rights are not reserved or a privilege of some. And therefore, we must understand the key principles that shape human rights for intersex persons of non-discrimination, equality, participation, accountability, recourse, and autonomy. As part of their obligations, states must respect the right to health and ensure that they do not deny or limit equal access for all persons to their economic, social, political, civil rights as well. And the obligation to protect includes the duty on the state to adopt legislation that take other measures to ensure equal access to healthcare and health-related services, also included, by the way, by third parties. And this is important because in a lot of countries, private healthcare providers are often excluded from the language of human rights, but also from the obligations that states have. The obligation to fulfill the right to health also requires state parties to pay sufficient recognition to the right to health in their national political and legal systems, preferably by way of legislation, and adopt a national plan with a detailed analysis, but also budgeting in how the right to health will be realized. It is important to continue embarking on the advocacy around intersex rights as human rights and ensure that we include healthcare workers and the profession in these discussions as well as advocacy strategies going forward. It is my wish today that my intervention has brought some focus on the right to health of intersex persons, and of course, I endeavor to ensure that the protection from violence and harmful practices, including on medical settings, ends. I remain available to you all to offer my support, collaboration, and technical assistance as we bring closer the UN procedures, health experts, civil society representatives, as well as member states who are key to ensuring that we actually overcome these challenges and we bring forth best practices based on human rights, based on evidence, but ultimately based on creating a society and communities that are conducive to a life of dignity for intersex people.